2001 in Port Hedland, which is a long way from here. It's about 20 hours by road in our vast state. It's 4 times the size of Texas, and it's got 1/10 of the people. So it's quite easy to feel a bit isolated and lonely in various parts. That day, I was tripped up straight away by 3 things. Firstly, my boss had actually left on stress leave and sadly never returned. And the other doctor at the hospital was from overseas and wasn't allowed to start due to visa issues. The third thing that happened was a dramatic electrical storm across the salt flats, and it managed to cut the town's power. I didn't know what was going to happen, but I did know it was going to be big. And so from that very shaky, isolated start in the Pilbara, I certainly learnt about one thing, which is that the workforce shortages around regional Australia are real, and they continue to today. I returned and was drawn back as an eye surgeon and have spent the last 15 years providing a service across the state, the length and breadth, putting eye care services into many regional towns with no cost barriers for anyone and seeing about 16,000 people a year. But there is so much more to do, because too often we see people who have lost their vision and are blind when it could have been prevented with an early check. So this is Teddy, and I've met Teddy 40 times in 5 different locations around the state. And he's had lasers and injections in the eye and surgeries, all to treat a condition called diabetic retinopathy, which is from his diabetes. The sad thing is, if we had met Teddy earlier and had seen the back of his eye, we would have been able to prevent it in 98% of cases. So there's a picture of the back of the eye which has arteries and veins that travel around like rivers through the beautiful northwest landscape in the red earth. And in the middle of that retinal photograph, there's a little white circle, which is actually the brain. And it's got 1 million nerve fibers that travel into the brain and give us our precious sight. As eye health professionals, we are trained to look at that and see little dots, white and red, that will be signs of this diabetic retinopathy on the march. Well, we've been amazed in recent years by research that now tells us from the same picture that someone is a woman who is 55 years old and is a smoker. And we have no idea how artificial intelligence can see that pattern in the picture. The tricky thing is, all this beautiful research has been very difficult to deploy in the real world. And that mismatch is captured poignantly in this magazine cover. Now, an incredible opportunity arrived. Tonight I want to tell you that story, which is where we had an opportunity to have a competition that the state government organised for a very big prize of $5 million. It was a global call out to digital health innovation to actually road test something in the Pilbara. So we put our hands up, it was in our patch, and we've been working with Google Health for some years, trying to validate and improve an algorithm for detecting diabetic retinopathy. And this was to enable us to spot this in a photograph without a human needing to do the grading. But here was our perfect chance to deploy it head to head against other algorithms that had cropped up in the recent years and see what it was really like on the road. But firstly, we had to get a good picture. And the idea of taking a photograph opportunistically of the back of the eye, the retina, has been around for a while. But these cameras are generally hiding in a broom cupboard in the clinic. It's meant to be taking a photo when someone comes for their normal chronic disease, but they're too difficult to use. So you can see there's a joystick there that you have to manipulate, many knobs and lots of buttons, and eventually you get a photograph that you have to stick on a USB stick and send to web. So what we now have is a totally different story. You can see they're wireless, automatic. Anyone can use them with minimal training. So we had our chance to stick our AI algorithm into these new cameras, head-to-head with others, and there was a clear winner. The Google AI was superb. It was 100% sensitive, didn't miss a beat, and nearly every photo was able to be graded. So we were incredibly excited about this because now a patient will have the answer on the spot, and the person taking the photo can communicate with them and initiate telehealth with a specialist to explain the treatment that might be required. I'd now like to turn to an incredibly exciting part of our challenge. This same photograph is now revealing a snapshot of the whole body's health. We are able to see from the same patterns what is going on in the heart, the lungs, the brain. This is something that would be akin to the window to the soul, and that's what the eye really has become for us. I'd like to show you this little camera in action now in a small clinic in a very remote setting. Off the Pilbara, there's a nursing post there, and this patient will be able to be seen by the nurse and have an on-the-spot diagnosis that a specialist would normally give, as well as a whole body health snapshot. And that is something in that town that is so unique because they don't have a blood path lab, they don't have X-ray around the corner, and this nurse can now connect up to a specialist or GP to initiate chronic disease. So the oculomics, which is the word used to describe the whole body health, has been a major breakthrough, and 2 of our team members in the challenge published an incredible article in Nature just in the last year, and it's a foundation model which is open source. So that means that we can take this huge body of work that's been done and fine-tune the tip of the pyramid with our own patients locally to make it fit for purpose and eliminate that ethnic biases that can occur in these models. So we've partnered once again with Derbyl-Yerrigan Health Service just around the corner, and they are helping us look through our last 10 years of eye photographs and connect them to the medical records so that we'll be able to use this generalizable open source model and put it into the camera as well. So that incredible excitement I felt in the lightning storm when I began was coupled with a lonely sort of isolation in the regions. And this challenge has left me feeling absolutely exhilarated that there's a real future for the AI in healthcare to tackle the big disparities in health that exist worldwide. The artificial intelligence doctor will see you now.